when a patient gets pregnant, there is many signs and symptoms that can happen that would lead her toward knowing that she's pregnant. Some of these signs are subtle and some of these signs are more obvious, and different females are different. Some of them would know about these signs and some of them will not. So I'm going to tell you about these signs, so if anybody have these signs, would know if they are pregnant or not. The first sign of pregnancy is amenorrhea. And amenorrhea is like when a lady misses her period. This is one of the most important signs of pregnancy, mainly in people that have regular periods. Because if you do have a regular period and then you miss your period, one of the main reasons you miss your period is that you are pregnant. But in some ladies where they have irregular periods, that doesn't work that way. Because if they have a irregular period, they will not know when their period is going to come. And then when they don't know when their period is going to come, they don't know if they're pregnant or not if they missed their period. So in regular periods, that's one of the first signs of pregnancy. In the people that are irregular, they would look for other signs of pregnancy because this one cannot work. And one thing you need to keep in mind that if there is some things that cause amenorrhea that are not pregnancy, like if somebody is stressed out, somebody is not sleeping, somebody is taking some medication, if they had surgery or anything like that, that can cause amenorrhea and it's not pregnancy. So keep that in mind when we're talking about amenorrhea as first sign of pregnancy. Some other signs of pregnancy are some digestive symptom signs. Like we all know, people when they're pregnant, they might cause nausea for them. They present with morning sickness. They feel like they're nauseous, they cannot eat, some of them would puke. And this is mainly due to the hormones of the pregnancy that goes up early in pregnancy, and this is how they end up being nauseous. Those usually most of the time disappears by 12 weeks of pregnancy. And some people, unfortunately, it does continue the whole pregnancy. But most of the time, it's a symptom of early pregnancy. It's one of the signs that push people to know that they're pregnant. Vomiting, which is like excessive nausea causing vomiting, is also a very important sign. And some people, unfortunately, would need hospitalization or getting some IV medication or IV hydration because of that. Some other GI symptoms of pregnancy, like constipation. The progesterone, which is a hormone of pregnancy, do cause constipation in females. And this is one of the things that bother a lot of our pregnant ladies. Some other things, some people have augmentation in their appetite. You know, pregnant ladies get hungry and they want to eat. Some other symptoms of early pregnancy might be due to other than the GI tract or just missing your period. Your bladder, likewise. If you're pregnant because you start drinking too much fluid and there is a release of a hormone that makes you thirsty and makes you also want to go to the bathroom too much, you start going to the bathroom many times and mainly during the night. And a lot of people would think this is like, oh, maybe an infection or not, but no, it is one of the signs of pregnancy. Other than the GI and the bladder problems, you have some breast problems. A lot of people early in pregnancy will have some breast tenderness. The breast will become bigger, they will increase in size, they will become more sensitive, and that's not just for the breast itself, it's also for the nipples. They will have some sore nipple and they're very sensitive, and sometimes they cannot even wear their bra because of that. This can happen due to pregnancy, but this also can happen due to some other medication like birth control pills and stuff, so you have to keep that in the back of your mind. The other thing that can happen early in pregnancy is some disturbance in the sleep cycle, because during the night they might not be able to sleep, which is called insomnia, and during the day, because they didn't sleep during the night, they will become very sleepy. And this is again because of the hormonal imbalance that happens early in pregnancy. So if you want to sum up all of the pregnancy symptoms early on, we'll start with missing the period, followed by some GI symptoms like nausea, vomiting, constipation, followed by some urinary symptoms where you need to go to the bathroom a lot and pee a lot, some tender, sore breasts, and some sleep disturbance. So when you have any of these symptoms, so it's better for you to go and do a pregnancy test just to make sure if you're pregnant or not.